Ladies and gentlemen, this is good morning. I wish you all very pleasant day today. We will have very interesting all session. Very briefly, I tell you, the first session is dedicated to patient safety. Then we will have a session about equity and access to healthcare. After coffee break at 11:30 to 12, we will have the important regional issues and Asia Pacific roadmap, and it will run to 2 o'clock. 2 o'clock, we have 1 hour break for lunch, of course, and then WPA member disease specific regional meetings. Yeah. Okay. Our first speaker today on this session will be Mondel Latif, Regional Advisor, WHO EMRO. Dr. Mondel Latif is a Regional Advisor at the Department of Universal Health Coverage Health System and responsible for Healthcare Quality and Safety Program at Eastern Mediterranean Regional Office of the World Health Organization. Dr. Mondel Latif is also a professor of preventive medicine at the University Hospital of Monastir, Tunisia. He also collaborated with WHO and other international organizations on several projects in the areas of quality and patient safety, as well as public health and health system development. Dr. Mondel Latif is member of the International Academy of Quality and Safety, the Middle East and North Africa Health Policy Forum, the editorial board of the Journal of Patient Safety and Risk Management, is an expert for International Society for Quality in Healthcare, reviewer for several international journals. He published more than 60 papers in peer-reviewed international journals. Please, Dr. Mondel, the floor is yours.
Thank you. Thank you. Good morning, everyone. So, at the outset, I would like to thank the organizers for inviting me and giving me this opportunity to share with you this presentation, which is about the global action on patient safety. In this presentation, I will first highlight the burden of unsafe care and the importance of patient safety, then the global movement that has led to several milestones in terms of progress with the patient safety agenda at the global level, an overview of the global action on patient safety, then what role is expected from WHO in advancing the patient safety agenda, what are the different actions that can be considered at the national level in order to adopt and adapt the global action on patient safety, on the global patient safety action plan. First, let me highlight the importance of patient safety as an important priority for health systems, regardless of their outcomes, their incomes. We know that this is a heavy burden that face health systems in high-income countries, in low and middle-income countries, and in low-income countries as well. It's critical for achieving universal health coverage, and universal health coverage without safety will be an empty promise. You cannot expect to have a meaningful universal health coverage without making sure that the services provided to the population are safe. It aims at avoiding harm to people for whom the care is intended, and it also underpins the principle of first do no harm. It's one of the most important components of the healthcare delivery. Safety is an entry point to ensuring quality healthcare, and there is a particular attention that should be given to patient safety in low and middle income countries, as well as fragile, vulnerable, conflict affected and vulnerable settings. The burden of unsafe care, overall, in general, it's reported in the literature that 1 in 10 patients continue to be harmed from safety lapses during receiving care. but these figures are underestimated. We did some work in the Eastern Mediterranean region, and we have found that based on retrospective assessment of medical records, we have found that up to 18% of patients faced severe harm. We conducted also a prospective study in some countries from the region, and we have found that 18% of patients were patient admission were associated with severe patient harm. So on average, what we have found, it's 10%, but you can easily understand that these figures are more severe, more serious in low and middle income countries. Recently, a study published by Dr. David Bates in the US reported that 1 out of 4 patients suffer unnecessary harm in US hospitals as well. So globally, unsafe care results in well over 3 million deaths each year. Recent estimates suggest that as many as 4 in 100 people die from unsafe care in low and middle income countries. The health burden of harm is estimated at 64 million disability adjusted life years, similar to that of HIV/AIDS. And what we need to highlight also that the adverse events and the problems that are related to patient safety are highly preventable. And the literature shows that up to 80% of these medical errors and adverse events are highly preventable. This is the global movement for patient safety. Well, it has started actually many years ago with the World Alliance for Patient Safety. And you know that since that time, WHO launched the challenges. What we mean by challenges, these are global priorities that need attention at the global level, such as the clean care, safer care that promotes hand hygiene, the safe surgery saves lives, the second challenge, and the third challenge, which is medication without harm. In parallel to this, several initiatives, several interventions have been launched, such as the patient safety curriculum, the reporting and learning systems, and so on. Then we have the Global Patient Safety Network, the flagship, and the Global Ministerial Summits. We have five ministerial summits so far, and recently we have had also in 2019 the WHO Resolution 72.6. So the first global ministerial was in London in 2016, then followed by Berlin in 2017, Tokyo in 2018, and Sheen is here, was very actively involved in it. So we have also 2019 in Saudi Arabia. It was planned in 2020 to be hosted in Switzerland, but unfortunately due to COVID-19, it was postponed. But this year actually, in 2023, it was organized in Montreux in Switzerland. So all these ministerial summits have paved the way for the endorsement of member states of the WHA, the World Health Assembly Resolution 72.6, which calls for the development of a global action plan on patient safety. And you can find in this global action plan, in this resolution, that the 17th of September was designated as the World Patient Safety Day. So this global action, this is the general framework for the general structure of the global action on patient safety. It has a vision, it has different partners, the governments, the healthcare facilities, the stakeholders, WHO. It has a mission, goal, the key principles, and also the strategic objectives. We will see them. So for the vision is a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. And the mission is to drive forward policies and actions based on science, system design, and partnerships to eliminate all sources of avoidable risk and harm to patients and health workers. And the goal is to achieve the maximum possible reduction in avoidable harm due to unsafe healthcare globally. These are the different partners, the governments, the stakeholders, different stakeholders, the NGO, the civil society, and all the universities as well, healthcare facilities, and the WHO Secretariat. There are strategic objectives. The first one is the policies to eliminate avoidable harm in healthcare. The second is the high reliability systems. The third is safety of clinical processes. And then the patient and family engagement. The strategic objective number 4, the health workers' education skills and safety, information research and risk management, and synergy, partnerships, and solidarity. So this is the framework, and for each one of the strategic objectives, we have 5 interventions, 5 strategies. So you can easily imagine we have 7x5 matrix, which is 35 strategic objectives or strategies. So how can a country get embarked in all of these together? What approach we need to adopt in order to address the patient safety based on all these recommended interventions? The implementation has 2 sides. One is top-down, and the other one is down-up. So regarding the downstream, we need to have the leadership commitment. It doesn't make any sense. You will not reach a concrete result unless the leadership is really committed to patient safety. And we have the experience from several countries from the region, in the Eastern Mediterranean region, where the commitment from the ministry is key, and you can easily see that the patient safety progresses relatively better than the others. So this is key. You need to have a baseline assessment, because you need to find out or to see what are the gaps, what are the real priorities in your country. This should be followed by an action plan that should be implemented. In addition to, you need to assign a team that will be oversee and coordinate the implementation. And then you need to think from the beginning, from the design of the program, on what needs to be done in order to sustain these activities. Because most of the time we think about developing a program, it's very beautiful on paper, then we move to another step, which is the implementation. The implementation is something that needs more attention, very important. And then the sustainability is also important. We need to make sure that the sustainability has been taken into consideration since the start. The upstream side includes the policy dialogue. We need to discuss together with the different stakeholders on the situation regarding patient safety, which means in practical, you have a situation analysis, you have people who are committed for this, you will conduct stakeholder mapping, who are the different stakeholders, then convene a stakeholder engagement meeting in order to agree on the key priorities. Because a country cannot afford all priorities. You have the infection control, you have the maternal and child health, many. And the capacities of the countries are relatively limited. So we need to agree. Most of the time, we recommend 3 to 5 key priorities first, then you can add in your program later on. The policy design, the interventions, you need to select the appropriate interventions based on your capacities and your resources, and also contextualized to the country. So you have the different steps, the landscape assessment, the commitment from political and organizational leadership, sustainable mechanism for implementation, national context and priorities, and the model for change. What is expected from WHO? These are the WHO core functions in general, but you can easily find that the support from the WHO can be through the leadership, advocating for patient safety to become more and more put as a top priorities in the health agenda. And this is the case through different resolution, advocacy, ministerial summits, and all the events. Setting norms and standards. The global action structure is part of the norms. It's a structure that countries can follow in order to address patient safety. But in addition to this, we are developing some standards the countries can use in order to address safety gaps, evidence-based policies and options, what needs to be there based on the information, collecting information and orienting the decision based on the evidence. Technical support, of course, shaping research agenda. And this is an area that needs more attention in terms of research on patient safety and the monitoring of the health situation in terms of assessing the burden of unsafe care globally. This is what we call the General Program of Work for WHO. Now we have the General Program of Work 13. And very soon in 2025, we will have the GPW, the General Program of Work 14. But at least now we are working with the GPW 13. And here to highlight that we have the mission to promote health, to keep the world safe, and to serve the vulnerable. The strategic priorities, we have the 3 billions, the universal health coverage, the emergencies, and the health priorities. The strategic shifts. And here I wanted to highlight the importance of tailoring the support to countries based on the maturities of their health systems. For some countries where the system is not really well advanced, we will mainly support them through service delivery to fill the critical gaps during emergencies and the vertical programs that are related to patient safety in this case, for example. For mature health systems, it's rather policy dialogues, orientation, and guidance on how to embed patient safety within the different programs. How to do what to do in order to upscale the implementation of the global action on patient safety. First of all, you will not be reinventing the wheel, because I know in many countries, they have already their own programs for infection control, for medication safety, for reporting. So we need to build on the existing improvement programs. Second, as you have seen, you have 7x5 interventions or strategies. So these are too many for some countries. This is why you need to prioritize your interventions based on the situation analysis. The contextualization means proposing and selecting interventions that are feasible, that are relevant for your context, but also those that are aligned with your health priorities. Like, for example, in Afghanistan, we are supporting them for the development of their national framework for patient safety. And we are aligning this with their national health priorities, such as, for example, the maternal and child health should be there through the implementation of some specific intervention in relation to this, as an example. Leave no one behind, ensuring access to safer care for vulnerable population. Most of the time we do something, but more attention needs to be given to vulnerable population, which is refugees, migrants, and all the vulnerable populations. Learning systems. In your system, you need to make sure that you have an information that you can capture in order to see to what extent you are progressing with your program. And this is what we call a learning system. Promoting patient and family and community engagement and accountability, and this is very important. So health systems are accountable for the public, for the population. So we need to make sure that the population and the public are involved, are participating in shaping the health agenda in general and patient safety in this case. Integrating with health policies and priority programs, because you will see that you have different programs, one program for communicable disease, one for non-communicable disease, maternal health, and so on. You need to make sure that your program is also being integrated and speaks to these priorities as well. The resilience, and this is learning from what we have witnessed during COVID-19. Resilience is also important, and patient safety shouldn't be considered for the delivery only or the response only, but also during the preparedness and the recovery as well. In EMRO, what we are doing in the area of patient safety to support member states in their journey towards the implementation of patient safety programs. We have the patient safety friendly hospital framework. This is a set of evidence-based standards that cover 5 domains of patient safety: the leadership and governance, the patient and family engagement, the clinic safe evidence-based clinical practice, the environment, and the learning, lifelong learning. So these are the 5 domains that are being, I think, included in this framework. And we have a set of standards that are divided into different levels. We have the critical ones, the core ones, and the development ones. Why? Because some countries cannot afford addressing all of them. So we propose to them the first 20 critical standards, for example. These are the minimum. You need to have this in order to make sure that you are respecting patient safety, considering patient safety. Recently, we published also the patient safety friendly primary care, the same philosophy. It includes the set of standards and criteria. It's designed the same way, critical, core, and developmental, and it's being adopted by some countries in the region, like Pakistan, like Iran, like Oman, for example, as examples. We have an action framework for patient safety and quality in fragile, conflict-affected, and vulnerable settings, and we are supporting some countries on the development of their national program based on this framework, based on the specificities of fragile, conflict-affected, and vulnerable settings. 2 examples, Somaliland and also Afghanistan. Some work is being done in Yemen as well. We have also developed a training course on patient safety and quality in FCV settings, fragile conflict-affected settings. And very soon we will have also a virtual version as well. Technical support and guidance to member states on the development and implementation of national policies and strategies for patient safety and quality. And also we developed a set of indicators to monitor and to report on healthcare health workers' safety at the hospital level and also at the primary care level. So in summary, these are the take-home messages. Where first, the heavy burden of unsafe care. Most of them are avoidable, and we have good returns on investment in terms of improving patient safety. Patient safety is critical to universal health coverage. It's a foundation for health system strengthening and health system resilience. Member states have committed to invest in patient safety through the Global Action on Patient Safety. There is no one-size-fits-all. Support to countries should be tailored according to local context and capacities and priorities. It is high time to ensure the effective implementation of improvement actions, and also WHO Global Action on Patient Safety provides the pathway to enhance member states' capacities to ensure safer care. Non-government NGOs and civil society organizations have a key role to play in advancing the patient safety agenda. With this, I've reached the end of my presentation. Thank you for your attention. I'm happy to answer any questions.
Thank you very much for the presentation of Dr. Latif. We know what is the action plan points. Now I will invite Dr. Ushiro. Professor Ushiro works as Deputy Director and Divisional Director of the Division of Patient Safety in Kyushu in Japan. I will not present the biography because we are short with time, but now we will know more how to engage patients, families, all in this plan. Please.
Is it helpful? Yes, please. So thank you for having me, and thank you very much, Yolanta, for kind introduction. Good morning again, everybody. Hello to audiences online. My name is Shinichiro. I'm a physician in Kyushu University Hospital in my country, Japan, and I also work in a foundation in Tokyo. It's called JQ, Japan Council for Quality Healthcare, which runs hospital accreditation, which runs National Reporting and Learning System, which also runs no-fault compensation for birth injury. It's called brain damaged baby or cerebral palsy, because we compensate our patient and families because if cerebral palsy takes place, we often see lawsuit, intense conflict in my country. And at the international level, I work as a board member of ISQA, and I also work for the government. So I have many hats. So I would like to describe my practice, particularly on patient safety promotion and engaging patient for patient safety at national level, international level, and institutional level. Here you see the chronological timetable as Mondale mentioned. I copied this slide from WHO presentation. WHO divide the history development on WHO patient safety promotion into 4 columns. In the first column, WHO adopted resolution on patient safety. Please note that resolution is really very crucial in implementing something in WHO. And in the second column, the first ministerial summit on patient safety was held in London by United Kingdom. And after that, I joined the steering committee of ministerial summit. And we held the third ministerial summit on patient safety in Tokyo. It was really successful. I will show you the slide and photo of the ministerial summit in Tokyo later on. And I worked closely with Ken Taneda. Who is going to chair the panel discussion later on. And the third column, WHO again adopted resolution, which is really powerful, and on global action on patient safety. The resolution clearly touched on the launch of the World Patient Safety Day and the development of 10-year plan on patient safety promotion. And I failed to mention the Tokyo Declaration. It was adopted in Tokyo Summit. Tokyo Declaration clearly touched on the launch of the World Patient Safety Day. So with the help of Tokyo Declaration, WHO was successfully launching the World Patient Safety Day in 2019. And now we are in the last column, the right one. The 10-year plan called Global Patient Safety Action Plan was completed. I am one of the members of developing the plan, and the WHO flagship initiative is now promoting, implementing the Global Patient Safety Action Plan. That's the chronological event which took place over the last 10 to 20 years. And this is the Global Patient Safety Action Plan Mondale mentioned. And there are 35 strategic objectives and actions. And if we closely look at the strategic objective number 4, it is closely related to patient and family engagement. And 4.1 result that co-development of policies and programs with patients. Number 4.2 is related to learning from patient experience for safety improvement. 4.3 result that patient advocates and patient safety champions. 4.4 is patient safety incident disclosure to victims. 4.5 information and education to patient and families. I acknowledge that all five items are really important. But at this point, I'd like to highlight 4.4, which is patient safety incident disclosure to victims, so that I would give you one case which took place in my hospital. And a couple of months ago, the surgeon conducted robotic surgery for female patient suffering uterine cancer. The robot has 4 arms like this. It moves like this. And at one moment, surgeon lost the control of one arm, and one arm disappeared from the screen. And at the moment, this arm injured patient liver and patient pancreas. And after that, the people, those who were involved in the surgery, didn't talk a lot about the incident. But I got incident report from the operating theater, and I called internal preliminary meeting with the surgeon and the people involved in the surgery. And I got a gut feeling that this could be negligent. So I called official investigation meeting in the presence of hospital director and professor of the Department of Obstetrics and Gynecology, and we concluded that it is negligent. Because we have annual contract with insurance company that provides indemnity insurance, damage payment. So we apologized the patient for the surgery and the injury of pancreas and the liver, and then we paid money to compensate for the loss of the patient. So that's what I have been promoting in my hospital. When I took my position 9 years ago in my hospital, there were 5 lawsuit cases on annual average, always 5. But now, only 1. So I was successful in reducing the conflict between hospital and patient. And in other words, I have been promoting candid response and swift response to patient and family in my hospital. Okay, and WHO DG, Dr. Tedros, has to report the progress of the 10-year plan to WHO Assembly every other year. So this year, the Dr. Tedros submitted interim report to the Assembly. It says that only 13% of countries that have patient representative on the governing board or the equivalent mechanism in 60% or more hospital. I think it is quite difficult for member countries to achieve this, but we need to make progress. In my hospital, there is a powerful committee which is equivalent to a governing board. It's called Patient Safety Audit Committee. It's regulated under the government law and regulation. And the corporate director of my university hospital appoint the member, including patient representative, and including plaintiff lawyers who work for patients rights. And then the committee surveys our activity, our patient safety activity, and the committee publishes a report to the director of the university. And if needed, we need to take corrective action together with the hospital director. So that's how it works in my country. This is a photo of the Patient Safety Audit Committee. On your right, I welcome the committee members, including patient representatives who suffered breast cancer in my hospital, and the plaintiff lawyers and other experts in my hospital. And on your left, I worked as the chair of Patient Safety Audit Committee in different university hospital called Miyazaki University Hospital. And this is our activity at the institutional level. So let's go to the national level activity. As I told you, and today and yesterday, the JQ is running no fault compensation for birth injury. It's we provide monetary compensation on no fault basis, regardless of negligence or not, and we also conduct investigation to publish investigative report, which is delivered not only to professionals but also to families, so that families would read the report and would know the quality of procedures given during delivery. And then we conducted a comparison study with the pool of latest reports and with a pool of all the reports. We made a comparison, and it turns out that some specific procedures that take place during delivery are improving through the investigation. For instance, fetal heart rate monitoring is getting better, and excess administration of oxytocin is decreasing, and the mechanical ventilation after birth, within 1 minute after birth, is improving. So through the compensation and investigation and prevention, we successfully observed the improvement of specific procedures during delivery. And you may want to ask about the lawsuit case or conflict case. We were successful in observing rapid decline in the number of lawsuit cases related to obstetrics and gynecology. So we are really proud of that. So let's go up to the international level. We held the Tokyo Summit in 2018. And in the program, we invite patient and family representatives. She is Ikuko Toyoda, who lost her son due to delayed diagnosis. And Ikuko was devastated after losing her son for many years. But after that, she rose up again for patient safety, and she launched her NGO, whose name is The Bridge. The Bridge means bridging between patient and medical professional and medical institutions. And she launched the NGO Bridge, and now she is working for patient safety. And I joined her activity, and we work together. For instance, in running no fault compensation system. Okay, and we of course we celebrate the World Patient Safety Day. Particularly this year, we celebrated the themes of World Patient Safety Day, which is engaging patients for patient safety. And I engaged in light up of the monumental tower in the city of Fukuoka, where I live. So I'm going to show you the big change of the color from this one to orange. Are you ready to watch the historical moment? So let's go. 3, 2, 1. Okay. Yeah. This is what I did in my city. Okay. So to conclude my talk, I'd like to describe my pledge. We are in a decade toward co-production and co-creation for patient safety. We think together, we plan together, and we achieve together along with the WHO Global Patient Safety Plan. And I conclude my talk by quoting the message from London Declaration in 2006. In honor of those who have died, those left disabled like cerebral palsy, our loved ones today, and the world children yet to be born, we will strive for excellence so that all involved in healthcare are as safe as possible, as soon as possible. This is our pledge of partnership from London Declaration 2006. Thank you very much for listening. Thank you.
Thank you very much. Thank you very much. And now the floor is for Lamia Al-Hazani. Lamia is currently heading Patient Empowerment Section in the Saudi Patient Safety Center, Saudi Arabia. Please, Lamia, come to us. She will talk about patient engagement in patient safety in the region. Thank you.
Thank you very much. Okay, so I'm going to talk about patient engagement in patient safety in the region. So my presentation is hovering around what the Saudi Patient Safety Center did and provided to engage patients in the country. But there are many other activities and achievements on national level that have been done on by MOH or by other institutions, and we are all having the same wave or the same move in our country toward patient engagement. So we can't empower patients without hitting all levels. So if you want to empower patients, you need to go to the patient themselves, you need to go to their families, you need to go to the healthcare providers, and also you have to touch base on the leadership. So we have some activities that have been done to the patients or for the patients, and we have some activities that have been established for healthcare providers. So we have one of the activities that have been completed in 2020 because of COVID-19 was the patient empowerment campaign. And this idea became live because we couldn't visit the patients in the hospital and we couldn't go physically and talk to them about their rights and how to be empowered and how to be engaged. So we came up with an idea, how about we use the digital screens in the hospital, the LCDs, by promoting messages in English and in Arabic, the native language in my country, to tell them about the key messages to be empowered. As you can see, some of them are in English and some of them are in Arabic. For example, speak up when you feel something is wrong, and ask your doctor if you did not understand, and etc., which are major messages in patient empowerment. And this campaign started, as mentioned, in 2020 during COVID-19. And in 2021, we reached 70 hospitals, and 2022, 250 hospitals. And now it became like an automated campaign that is run and adopted by hospitals to be implemented in their LCDs. And for the hospitals that do not have digital screens, they reached out to us and asked us, how can we promote these messages? We advise them to print it or hang it anywhere so patients can read this message. The other thing, which is the baseline of the other project, which is patient safety caravan. It's not an actual caravan, it's a virtual caravan. And this activity is to visit patients in the hospital, either in the waiting areas, in their room, in the admission room, and also in the clinic. So the idea behind the patient safety caravan is to gather interested people in the topic, like, for example, volunteers from the hospital or either volunteers from the medical colleges, to go and visit hospitals and to talk to them about their rights and patient safety and other aspects of patient safety. So this project was led by our colleague Makia Majrashi, and it started since 2018. And it became very popular in our hospital, in our country. It started by the Saudi Patient Safety Center, but then it's been adopted and implemented by hospitals themselves and also in other countries. For example, in 2021, we had 6 patient safety caravan in Pakistan, and we did the TOT online training led by Dr. Hussein Jafri, and then they implemented in their hospital and they give us their feedback. So the idea behind this project is to grab a volunteer, either from medical or non-medical interested persons to come and go to visit the patients and talk to them about their rights and how to be engaged. The other project is we thought about a group of a sample of people who are not targeted very well, who are children. So we thought, why not to base or to raise our community from the scratch, from the early age, to become more engaged from the beginning, from their school age. So we created a project called Salama Friends. Salama in Arabic is safety. And we called this character, as you see here, Salama. He has no legs, nothing, but he's just a flying character. And we started this project by going to the schools and giving presentations to the students in early age, talking to them about safety aspects. And then it became, it shifted to having a video motion graphic, and it has been posted on YouTube. And the idea behind this is to touch base on every aspect in patient safety, such as medication safety, hand hygiene, and other aspects, and how to talk to your patient, how to know the healthcare provider, how to become more engaged and more empowered. So in 2022, we came up, or we delivered and conducted 12 motion graphics in Arabic and with English subtitles. And in 2023, we reached to Riyadh, which is the capital of Saudi Arabia. We reached to the Ministry of Education, and we implemented this in 900 schools in Riyadh, and it reached 136,000 students. So, and we are now starting with another city, which is Tabuk city, and we want this message to be reached to all children to become more empowered and engaged in the country. And also the Patient and Family Advisor Council, which is a very famous tool that is being implemented by many countries. In our country, let's start with this one. This is the Patient and Family Advisory Council for Patient Safety. So it was created by us, the Saudi Patient Safety Center. And as you can see in the picture, there are members from patients. 50% from the attendees are patient representative. And we have our DG, Dr. Ali, is leading this meeting. And we have representative from the Saudi Patient Safety Center members. And this was created in 2023 in alignment with the World Patient Safety Day. And we discussed many aspects and heard the patient, and also co-designed and co-developed some ideas with them, and it will continue in the future. And the other thing is that in every hospital or in every cluster, we have, in our country, we have clusters and then hospitals. And these clusters are running every hospital or as a regulatory body for every hospital. They have advisory council of their own. So in the advisory council is usually led by the CEO, and they have members from patient representative and members from this hospital members. And we have also the patient empowerment course for healthcare providers. So we thought, okay, we are reaching out to the patients, but also we want to deliver the message of patient empowerment to the healthcare provider. So we created a course that started in 2018, and we conducted 6 of them. And then 2019, we conducted 6 also in many areas in our country. And then, as you know, because of COVID-19, we couldn't conduct it physically. So we started using this time to improve the material that has been developed in the past. And in 2019, we conducted the first patient empowerment course as its new version, also in alignment with the World Patient Safety Day, since the theme was patient empowerment. And we are now currently working on something called patient empowerment framework, because we realized in the country that every healthcare institution or every healthcare provider is defining patient empowerment differently. Some of them are defining it as patient empowerment, some of them as patient engagement, some of them. So it's different. We thought that it is very important to unify the language of patient empowerment and to create a framework. And this is under construction. We are working on it as we speak. And it will contain definitions, of course, elements and measurement tool. We will create a measurement tool that will cover all the elements that we believe is important and is being implemented based on the current state assessment that we did. So this framework hopefully will be published by the end of 2024 in our website. That is tailored, as Dr. Munder said, you need to tailor the material that you have into your country that fits your country. So after the current state assessment, we realize some aspects that we need or gaps that we need to fill. Last but not least, we have the Choosing Wisely, which is a national or global initiative. And recently in 2019, we adopted this initiative to cover this important area and to have the narrative hovering around the patient safety. So if you don't know Choosing Wisely is an initiative that encourages the conversation between the patients and the healthcare provider. So together they can choose wisely the care that is being provided to the patient, and also to increase the safety of the patient and decrease the unnecessary care that is being given to the patient. So there are two areas for Choosing Wisely. There are the enhancing patient safety by reducing unnecessary requests using the healthcare provider recommendation, as you can see on the right. And you have also materials to empower patients to choose wisely the care that is being given to them, on the left, and then for patients, as you can see in the right. So this is the idea of Choosing Wisely, which is covering two main areas: patient safety in general and empowering patients to choose wisely. So as you can see here, it's improving in our country. It started only 2019. And then the regions, the champions, the successful projects, recommendation societies, all are scaling up until today. And we are now having more and more of all the elements mentioned above. So Choosing Wisely is basically a patient empowerment tool to help patients learn that they have a voice, and they need to choose the care they are given. Thank you very much. This is on SPSC level, but we have also other patient empowerment projects that is being implemented by other entities, but I didn't have the chance to present it here. Thank you very much.
Thank you very much, Lamia. Now we know much more about action plan for patient safety done by WHO, and I wish to invite 4 panelists. I can say, by the way, we received a lot of questions, and we will try to answer all these questions. Don't worry, we send it by on our page, because there are many, to Dr. Montelatif, to Professor Shinushiro. So we really answer all questions. But now please join our first table, Dr. Arora. Yes. And I wish Dr. Arora represent National Thalassemia Welfare Society India, Makia Mairashi, President Saudi Patient Experience Club, and Inge Damati, Center of Excellence for Patient Safety and Quality Indonesia, and Regina Namatakamoga, Community Health and Information Network Uganda. Yeah. Please join us. And the first question is to Dr. Arora. What are the barriers in patient engagement? Dr. Arora, it's better if he answers here from this position. Yeah, so please, the floor is for Dr. Arora.
Thank you, Lanta. See, as we know, the patient engagement and empowerment is the most important part of the patient safety, and they are the
key stakeholders in the patient safety process. See, there can be many barriers. One of the most important barriers is language and culture. And especially when we see our India, it's a very diverse country, I think most diverse country in the world. We have at 14 official languages and at least 20, 30 languages are spoken all over the country. So first language is that is a language barrier, because see, we at sitting at Delhi, the capital city, we see the patients all over country having the different languages. Second is health education of the patient. See, patient is not always aware of the health education, what the treatment he is taking. Then, and many times the patients are even unwilling. They say, okay, I have seen many cases, my even personal practice as well. When we ask the patient, okay, we are giving you this one, A, B, C, D, two options are there. Then they say, oh, doctor, I don't want to understand all these things. It is up to you what you want to do, get it done. Because patient is either has no time to listen or are not, they are not least interested, or is not aware of his condition and don't want to be there. So many times the patient's unwillingness as well, where it doesn't want to go into this engagement and empowerment. Then you can say reluctance of the healthcare providers. It can be at the medical doctor level or the nurse level. See, medical doctors consider that to be superior most person in the healthcare system, and they don't want to interact with the patient so closely. That's the one part. And secondly, the nurses as well, because the number of patients they are seeing, especially in the public sector unit, they are very high, and they don't have time to interact. So the workload, that is also very a great barrier between the engagement, both for the doctors and the patients. Secondly, at the time of, you can say, discharge, you can say transfer. At the time of transfer, that adequate information is not given to the patient. Because, see, whether it is a transfer from one department to other department, or from one healthcare facility to other healthcare facility, or to home, or from one shift, even for the shifting, from one unit to other unit. So they are not being adequately engaged at that time as well. And many times what happens, even though the patient is interested, is well educated, he's aware of health condition, he wants to involve it. But only thing is that doctors or nurses, they don't want that to be, patients should meddle with their, or you can say mess up with their process. So they don't want to get interference with, from the patient or the partner in their system, and that is again a barrier. Thank you.
Thank you very much. I think these barriers are general, so thank you very much for stressing. Now we will ask Makia Mairashi to tell us what steps can be taken to refocus the government's attention on prioritizing and strengthening efforts to improve patient safety on a larger scale. Makia, the floor is yours.
First, thank you so much for inviting us to be part of this World Patient Alliance. Actually, it would be very helpful to participate in any alliance. Is it clear? Sorry, like this. So first, I would like to appreciate the efforts done by World Patient Alliance, as this really considered as one of the most important steps in supporting this movement. It has been proven, as what Dr. Minder said, that in the Global Patient Safety Challenges and Initiative, World Patient Alliance for Patient Safety, such as Patient for Patient Safety, has been created an effort that cannot be done alone. So, and from our experience in our kingdom, we are having now a national center for non-governmental organization. We are now registering in this. This will be one of achieving the Kingdom Vision 2030. So we are now increasing in terms of how many numbers of non-profit organization. The aim is 10,000 organization, but now we are, it was 2050, but now we are reaching to the half of the target. So we are moving toward this. Not only this, during the G20, when our kingdom was the hostess of this big event, we were a group of non-governmental organizations. So we included the patient safety to be part of G20 agenda. Yes, okay. And last week, we have participated in building the bridge of the global health, how we can build the bridge between the healthcare sectors and non-governmental organizations. We are having a large burden on our Ministry of Health. We as non-governmental organization, we could have a lot of service, so we can provide this service through non-governmental organizations, and we took the burden of Ministry of Health in these steps that we can provide a good service for our community, because we know better as we have been noticed from different non-governmental organizations. We are the expert patient, and we could provide the service through the passion. I think I have answered most of the steps. So if you have any further questions, you can ask me.
Every panelist one question, and then we have more, of course. Now we will invite Inge Damanti, and we ask her about what initial steps can we take as patient advocates to improve patient engagement in healthcare decision-making and quality improvement processes. Please, Inge. Now,
Okay. Audience online, can you hear my voice? Okay, hopefully all good. So the question is, what initial step can we take as a patient advocate to improve patient engagement in health? So maybe I'm taking this within the context of Indonesia, for example, because as a patient, and actually there are so many patient advocates in Indonesia, but it's like they don't have like the similar voice. And maybe if we look at the empowerment terms, not all the organizations are realize the importance of the patient empowerment. So it's like so many different organizations has established, but maybe they don't know the right way to help people, help the patient, and also bring the advocacy at the higher level. So I think the initial step is the important things is like we need to make like one voice, one bigger voice, and raise it up to the government level. So for example, what we currently do in the Center of Excellence for Patient Safety and Quality is we try to map all the organizations that involved with patient, and we invite them to a meeting, and then we will raise the importance of the issue of having one big voice. And we will also invite the government, which is Ministry of Health, and also the Department Health Office at the regional level, and we will bring the issue that bring the agenda also from the global patient safety action, that there is a need to have like the patient representative at the hospital level, and also at the regional level, and also at the national level. So I think that's the answer. So thank you so much.
Thank you very much, Inge. Now I will invite Regina Namatakamoga. She will give us some practical tips how to engage patient, families, communities, and what are the key achievements, because she is an expert in this issue. Please, Regina, the floor is yours.
Thank you very much. I'm delighted again to be here. Just a small background about why I'm passionate about patient safety. I was affected at personal and family level. I almost died when I was having my second child due to a near-miss incident. My mother almost died due to an overdose of her hypertension drugs, but was saved by my nephew who had knowledge, who had health literacy education that highlights the importance of patient empowerment, engagement and empowerment. And we are moving from engagement to empowerment because of the value of that. At community level, I've interfaced on a day-to-day basis with many, many instances. As you've heard from the different presentations, many people are dying every day due to preventable harm. We are happy to know that the WHO has prioritized patient and family engagement because they are very critical. I'm sure we all know that this cannot be overemphasized, and based on the presentations that we've had this morning, patients are critical part of the safe care. As such, they need to be empowered. So at my organization, the Community Health and Information Network, what have we done? We have mobilized the communities right from the grassroots levels, getting to the last mile patient to ensure that we engage and empower them on issues of patient safety. Believe me, many years ago, this was a gray area. And in my country, they call me patient safety because I've knocked on every door to ensure that we raise awareness on patient safety. And I ensure that patient safety is integrated in the work of Community Health and Information Network chain, the organization I work for. This was based on my experience, the experiences I've told you at personal and family level. So we took it upon ourselves to work together in a structured way to ensure that we bring on board, we leave no one behind. And we've not done this alone. We've worked with different stakeholders, the Ministry of Health, the regulatory authorities, the National Drug Authority, the key healthcare stakeholders. These included many of our partners include the IDI, Infectious Disease Institute in Uganda, Medical Access. We have now the Rotary Club, the Insurers Association, because we know that patients many times do not have spend out of their pocket, which prevents many to access healthcare. So we're bringing in Uganda, we don't have the national policy on health insurance. So many people have to spend out of their pockets. And as such, many people are not able to seek care, safe care at that. Many times they go to traditional options, which many times are unsafe. So in our work, we ensure that we tell them about the dangers of mixing herbal medicines with conventional, or even not going to the right sources. But of course, there are also many counterfeit medicines. So as such, we have created a network of patient advocates. We have about 100 patient advocates drawn from the different disease areas. These are members of the Uganda Alliance of Patient Organizations, as well as the World Patient Alliance. They come together, do joint work, and reach the unreached because they use appropriate approaches, music, dance, and drama, debates, which many of our members in the community understand because of the low literacy levels and health literacy levels. I was very happy to hear about Lamia's initiative in South Africa, because we have also learned that for people to have a culture you have to develop it early in life, just as she has said, and I'm glad that we're going to have to learn from you as well. So we have established, we call it Start Early Initiative from the schools, right from preschool. And it's amazing how these little ones can adopt easily to different cultures and learning very early in life. So they educate their parents when they go back, and we're getting very, very positive feedback. So we have established 50 health literacy and patient safety clubs in the different schools that we work with. Again, our patient advocates are doing work in the different institutions they come from. And I want to highlight one of the key case study. We worked with Infectious Disease Institute in Uganda. We started with a pilot of 5 patient advocates. These were HIV positive. They were in an HIV clinic in IDI. We gave them the training on how to identify patient safety issues in the clinic. After this pilot, we actually realized that they had the capability to identify these issues. It was scaled up in 7 clinics under IDI in Uganda. And then we had 92 training of trainers trained, and it's still being rolled out. This was introduced by a patient advocate who actually attended our first Patient for Patient Safety workshop. So that shows you the power of patient advocates and the work they can do in the organizations. So basically, it's about, like we had yesterday from Hussein's presentation, it's about consistency. It's about continuous. You don't give up. You knock on the doors. In Uganda, when they see me, they say, Regina, patient safety. So it's about persistence. There's so many challenges along the way. I've been thrown out of meetings. I've been, called different names, but you persist. It's about persistence. It's about commitment, and it's about passion, but as well as working together, ensuring that you don't leave anyone behind, so that we can achieve our goal. So what do I want to tell the key stakeholders here? Basically, it's important to have, we don't want to leave anyone behind, but again, we cannot do it alone. We need the support. Patient safety is still a growing area. We've seen a lot of improvements, but we need funding for it. We need resources at every level of resources. You can make a difference. We want funders, partners to embrace patient safety and be able to support initiatives so that we can all work together to ensure that no one is harmed, because indeed, these are very, very preventable incidents. Thank you very much.
Thank you very much. Regina made the conclusion, but I have questions for the next 2 hours. But one question I will for Dr. Montelatif to answer, because it is very practical. How can patient advocates work with WHO country office on patient safety? Please join us for a second and tell us these few tips. And please, Haris or Rehan, prepare. You do a photo after for all panelists and our speaker from this session. Thanks God, everybody there, not online, so we have a chance to be together on common photo. Please.
Yeah, the question was how to work with WHO on patient engagement. Yeah.
Patient advocate.
Patient advocate on patient, yes, patient advocates, how to work with WHO on patient safety or on general, on patient safety. So this is the question of Hussein, right? Okay, so this is something very important. As I said, the programs in patient safety will not be able to make any concrete progress without the input from the advocates. And this can be considered at different levels. At the policy level, they are key in terms of developing the action plan, the policy, the program. they should be involved. They should provide their inputs in terms of selecting the priorities, selecting the interventions, and spreading the word, advocating for the development of this of the program at the national level. At the institutional level, they should be represented at different levels from the design of the different programs, and this in this case is the patient safety program, the design of program, the implementation of the program, and the monitoring of the program. So these are the three levels they can do. At the community level and at the personal level, these should be also included in terms of building their capacities on what patient safety is, how they can contribute to it, and also they can play a role of messengers on how to educate patients on key priorities. And this is what we call the patient safety champions, for example. Champions, these are the ones, those that are committed to patient safety and ready to collaborate and to partner with WHO on this.
Thank you. So very short, we take the note and Dr. Arora will add something.
Just a thing. I think we can get a specific answer, frankly speaking, because even this is a question in my mind for so many times. How we can link, how a patient advocate will link with the WHO office. That is important because all this should be done. Because WHO office, country office, regional office doesn't recognize us. Isn't it? So our service or our importance, our contribution should be recognized.
But what we do at the regional or global level, we communicate through the country office and to tell us about the advocacy association NGOs that are related to the field, to the area of interest. And it's through the country office. If I don't think that if you have a relevant program, an interesting activity that aligns with the country priorities and also WHO agenda, they will help you and they will be more than happy to welcome you. This is what I see from different, and we are in need for identifying and selecting additional patient advocacy associations to work with us. This is what I really see.
Thank you so much.
Maybe after this lesson, the lesson about advocacy from Hussein, they will accept you.
Dr. and please come all the families and presenters. We will have a photo. It's a unique chance. We are all here.